Shocking fact. The brain of someone with epilepsy can generate the same amount of electrical activity during a seizure as a 100-watt light bulb. That's not how our brains are supposed to function. In a healthy brain, neurons communicate through carefully controlled electrical signals, like an orchestra playing in perfect harmony. But in epilepsy, this harmony breaks down. Think of the brain with epilepsy as having faulty electrical wiring. Normally, neurons fire in organized patterns, but in epileptic brains, groups of neurons suddenly start firing together in an uncontrolled burst, creating what we call a seizure. These electrical storms can start in one area or spread throughout the entire brain. What's fascinating is that epilepsy isn't just one condition. It's actually a spectrum of disorders with over 40 different types of seizures. Some people experience violent convulsions, while others might simply stare blankly for a few seconds. Some can even sense a seizure coming with an aura, strange smells, visual distortions, or unexplained emotions. Between seizures, the epileptic brain often functions normally. Many people with epilepsy have completely normal intelligence and abilities. The condition can be caused by genetics, brain injuries, infections, developmental disorders, or sometimes has no identifiable cause at all. Modern brain imaging shows that during a seizure, blood flow and metabolism in the brain dramatically change. Areas involved in the seizure light up with activity, while other regions may temporarily shut down. This explains why people often can't remember what happened during their seizure. Treatment typically involves medications that help stabilize the electrical activity. For some, brain surgery to remove the problematic area might be an option. Newer treatments include neurostimulation devices that work like pacemakers for the brain. Understanding how the epileptic brain works helps reduce the stigma around this condition that affects 50 million people worldwide. It's not a mental illness or sign of possession. It's a neurological disorder with physical causes that we're getting better at treating every day.